And now I want to introduce you to Tony Mancuso from the American Association of Medical Colleges. He will be talking about the Summer Health Professions Education Program. Welcome, we are very glad to have you. And if I am not mistaken, one of your alums is also here, Jose Ortega, and he, you can also have him connect and say something if you want. He participated at Howard University two years ago, I think. So welcome, Tony.
Perfect, perfect. And we can all see the slides, correct? I just want to make sure everything's sharing good and
yes.
Perfect. All right, so my name's Tony Mancuso, and I serve as the Communications and Outreach Senior Specialist for the Summer Health Professions Education Program. I work directly with the Robert Wood Johnson Foundation, who we're funded by, to ensure that branding guidelines and basically all the verbiage that we're using is consistent throughout our program. So I want to kind of go over a few things with us, you know, and really go into what is SHPEP. SHPEP is a free 6-week summer enrichment program for college freshmen and sophomore students that are interested in the health professions. Just that simple. Our program is committed to strengthening the career development of underrepresented and/or economically disadvantaged students while preparing them for a successful career in the health professions. Now, for those of you who are interested in the health professions, over 65% of our applicants who apply to medical and dental school are accepted. This is a national program, very reputable, and you know, many admissions officers understand the importance of SHPEP. Now, you know, due to the COVID-19 pandemic, physical distancing guidelines, and the closure of some of our campuses, SHPEP will be 100% virtual this summer. Now, as far as on our end, you know, the health and safety of our scholars always comes number one. So again, you know, we had to make this decision prior to the application opening, which was November 1st, just to ensure that, you know, our students truly understood what they were applying for and what type of experience they were getting ready for. Now, for those of you who are aware or unaware, we were virtual last summer as well. So we feel very confident in providing a successful program for those who decide to participate this year and apply. Now, you can get experience in any one of our health profession tracks that we offer, which are medicine, dentistry, nursing, optometry, pharmacy, physician's assistant, physical therapy, and public health. And you can gain that experience at any one of our 12 program sites, which are Columbia University, Howard University, Rutgers, the State University of New Jersey, UAB, UCLA and Charles R. Drew University, University of Florida, University of Iowa, University of Louisville, University of Nebraska, University of Texas Health Science Center at Houston, University of Washington, and last but not least, Western University of Health Sciences. Now, what are the benefits of participating in SHPEP? Well, each of our students will receive a stipend, and more importantly, you know, they'll receive guidance from current admissions deans, health professionals, students in health profession schools, and our alumni base of over 30,000 on how to pursue their career of interest. Now, we've been around for over 30 years, so we have a large alumni base, and they're very active, and they want to see you, you know, get to that next step. Now, what are the eligibility requirements? You must be a high school graduate and currently enrolled as a freshman and sophomore in college, have a minimum overall GPA of 2.5, be a U.S. citizen, a lawful permanent resident, or been granted DACA status by U.S. Citizenship and Immigration Services, and you cannot have participated in the program previously. There are other factors, you know, for consideration, and they include identifying with a group that's racially or ethnically underrepresented in the health professions, coming from an economically or educationally disadvantaged background, or having demonstrated issues and interests in affecting underserved populations. Now, our program sites engage in what's called holistic review, which means they're looking at more than just your GPA. They want to know your story, which is why it's critically important for you to submit a compelling personal statement and a strong letter of recommendation. My little quick tip of advice, it's okay to ask your letter writer or whoever is providing you a reference if they're going to write you a good letter of recommendation. And that's a fair question. You know, it's one, you want to make sure that, you know, they have a full understanding of who you are as a person, and why the health professions are important to you, and they can speak to some of, you know, some of those academic achievements that you would have had, or if you've worked with them in the past, you know, you can figure that piece out as well. Now, what activities are you going to participate in? Well, you'll gain academic enrichment in the basic sciences and math, career development activities such as mock interviewing and resume building, learning and study skills workshops, which will help you maximize working in individual and group settings, exposure to virtual clinical settings, which is what's needed right now in order to matriculate to a health profession school, workshops in financial planning and health policy, and interprofessional education that addresses the effective collaboration across the health professions. Basically, you get to learn how each of the health professions work with one another. We require one official transcript from each U.S. territorial, Canadian institution that you would have attended. As far as the letter of recommendation is concerned, it's a letter from a pre-health advisor or college professor from your major field of study. In the case that you can't get a letter from them, we will accept a letter from an employer that's within a health professions field or from a high school science teacher. Now, our application opened November 1st. The deadline is actually coming up relatively soon. It's February 5th. It's not too late to start an application. You have enough time right now to get your application in, get your materials in, your transcripts. The biggest thing with the transcripts or the letter of recommendation, just make sure that they're postmarked or timestamped no later than February 5th. That's the biggest thing. So yeah, as long as they don't need to be received by February 5th, they just need to be postmarked or timestamped. And our decisions are released on March 15th. Now, I definitely wanted to give us time to go over questions if anybody would have had any. This is our contact information. We're toll free. If you want to contact us, if you want to check out our website, it's shpep.org. And if you have any email concerns, feel free to email us at shpep@aamc.org.
I have a question.
Sure.
Under certain circumstances, are they flexible with extending the application deadline for 1 or 2 more days?
No, it's a firm deadline, unfortunately. But again, you know, you can start the application now, you know, and as long as your materials are postmarked or timestamped by February 5th, that's the biggest thing. You know, as far as like the letters of recommendation, we accept those via email, and as far as transcripts, we accept those via email as well. But they need to be, as far as transcripts, they need to be issued directly by your institution's registrar's office.
Okay, my only concern is that my letters of recommendation would be from providers, and these providers, with everything going on, I'm not very confident about having those letters of recommendation sent before this deadline.
And I definitely hear the concern. You know, what I would ask you to do is just, you know, if you're not able to get that letter from that specific person, what you could do is, you know, work with your pre-health advising office and try to figure out, you know, ways that you can get a letter from that, you know, maybe them or maybe somebody from your major. Again, you know, we offer a different variety of options that you can choose from. So it's just, you know, in this situation, you need to figure out what works best for you.
Right.
Does that make sense?
Yep.
Perfect.
You talked about the 12 sites. Are there sites that are more focused in one area or another? Are there are they all offering the same? Is it different based on location or availability of the sites in terms of the, I don't know, hospitals around? So what is the difference between the 12 different sites? Not the specifics, but just like a broad answer.
Okay, so I'll start with similarities and I'll go into differences. So, you know, as far as each program site, they offer medicine and dentistry. Those are our two staples. And as far as, the other health professions, that's where they can typically differ. Like, we offer physical therapy at 3 program sites. We offer public health at 4 program sites, nursing at 7. So it's just things like that. So it all depends on on their end, like how they kind of weave it in. Now the curriculum is going to vary per site, but even if they're still exposed to how each of the health professions work with one another, and they make sure that even though if they don't offer those tracks, like let's say physician's assistant as an example, what they'll do is they'll organize a day so like that you can still get that exposure for physician's assistant.
Thank you. Anybody else? I know that I always curious, so I always have some questions, but students, any of you have any questions? I know that there are multiple dates available and some of them kind of overlapping as you're making the decisions, because you have to choose the sites that you are more interested in. Let's say that your first choice is full. Is that automatically then maybe send you to eligibility for the second choice, or how does the decision making as you submit your top 3 choices?
So you're right. Like you can apply up to 3 program sites, and really it just depends. It's not like, hey, you get accepted here, but you don't get accepted here and here. Like you could essentially, be accepted at each of the 3 program sites that you do apply to. That could potentially happen as well. So really, our program sites are the ones that are making those decisions. So this is like what I like to say with the SHPEP application. It's basically like a glimpse into what it's like to apply to a health profession school. So if you're interested in applying to medicine, you'll get a sense of like what the AMCAS application is like. And I use that as an example because, and I think it's a direct example because our application is actually framed after the AMCAS application. So you'll get a good sense of what it's like to go through an application process and things like that, obviously without the interviewing and things like that, but you still get a sense of how the application works.
Thank you. Jose, would you mind joining for a second and maybe sharing a little bit of your SHPEP experience?
Sure, I can do that.
Go ahead.
All right. Okay, great. Well, yes. Well, my name is Jose, and I was lucky to participate in the SHPEP program in 2018, in the summer of 2018. That was my very first experience in something like this. And I think the highlight of the program is that you got exposed to different students, and you got to build those relationships that they can last for a long time, for a lifetime actually. And you get support from them. Like if you are challenging, you're challenged with, let's say like in that case, we had to take classes throughout the day, and sometimes like there are classes, they are at the higher level that you are understanding, but you got the support from students and from the faculty, so you got through those parts. But as Antonio also was mentioning, that you got those opportunities, such as making the interviews, or having those well, we also had those shadowing opportunities depending on the field that you're pursuing. So for example, like in my case, I am pursuing nursing. So I was able to shadow a nurse at the hospital. So that was a very unique experience, and that really allows you to see if you that's something that really you're really interested in. So just having that, shadowing that experiences, I think is a great help for you to really see if you're gonna like what you're gonna study, or it's something that you want to change your major. What else I can say about it? Yeah, pretty much is, that's about it. I think that's the most highlight about it. And there's so many other opportunities that you're exposed to, such as, building also relationships with faculty. And so for example, one of my mentors, she was a nurse, and she provided us with, great resources. And another thing, like I'm still in contact with some of those nursing students from other universities or other states, and they're also, from time to time they share some links about scholarships, or just asking, how things are going for you as a student, like if you're still, pursuing your dream. And it's just like, I think it's very rewarding to know that somebody is out there caring for you. So yeah, that's pretty much my experience.
Thank you, Jose. Any questions? I know that over the years we have had several students participate in the, I'm having a hard time spelling all the letters, so I'll go ahead and say SHPEP, but in the SHPEP program, we appreciate having Tony here today. Tony, are you able to share those slides with me so I can have them? We have a colleague in the library that has created a summer opportunity hub for us, so they will go there.
Yeah, I can definitely share those. Right after this meeting, I'll make sure to send them to you directly.
Okay. Anything else that you think that the students should know about the programs?
I've dropped a couple of links, just to kind of be helpful in the chat. I think that's a really good start. Again, our deadline is February 5th. I encourage, if you're eligible to apply, please apply. This is a really great opportunity. And again, students who participated in our virtual experience last summer, honestly, we have an ambassador program where they help to, speak about the program, do national presentations and things like that. They've gone on. We have a good amount of them that are saying, wow, this is great. And I've shared an actual video from one of our ambassadors, which is the glimpse into the virtual experience. I would recommend checking that out so you can hear the realness of our ambassador who participated in the virtual experience.
Thank you. Thank you. I'm going to